Are you starting your puppy's natural diet and are afraid of making mistakes? This video is the complete and definitive guide to starting the BARF diet safely, even if you've never done it before. Understand why the food transition of puppies needs to be done in specific phases. Find out what the ideal cuts are, how to assemble the correct proportion of fleshy bones, meats, giblets, and vegetables, and how to adapt the diet to your dog's growth month by month. Also learn what supplements may be necessary and especially how to interpret your puppy's body signals, from the shine of the fur to the consistency of the stool. This video was made for those who want to offer the best from the first day of life, respecting the natural development of the puppy and avoiding the most common mistakes that can compromise his health forever. Get ready for a journey of awareness, bonding, and responsibility. In the end, you will know exactly how to offer a balanced and safe natural food for your puppy to grow strong, healthy, and happy. Subscribe to the channel and activate the bell to follow new videos about natural food, health, and animal welfare. Introducing a puppy to the BARF diet, biologically appropriate raw food, is one of the most impactful decisions a pet owner can make for their dog's health. But, contrary to what many imagine, starting the right way involves much more than offering raw meat in a pot. We are talking about a process that needs to respect the animal's physiology, its stage of development, and above all, its capacity for digestive, metabolic, and immunological adaptation. It is in this period between weaning and the first months of life that structural changes occur in the gastrointestinal tract, which determine the efficiency of nutritional use throughout life. A common mistake among beginner owners is to think that puppies can simply enter the BARF in the same way as adult dogs, but a puppy's stomach is still maturing. Gastric pH, responsible for breaking down proteins and eliminating microorganisms, is less acidic in the first few months. This means that exposure to raw meats of poor origin or inadequate bones can generate not only digestive discomfort, but real risks of infection, diarrhea, or even obstructions. The first safe step, therefore, begins with the origin of the food. Fresh meats with sanitary control, ideally frozen before use to ensure the elimination of possible parasites. The meat cannot have a strong smell, dark color, or be close to expiration. For a puppy, every variable matters. The second essential point is the gradual introduction. Puppies that came from a commercial diet, such as dry food, do not have intestinal microbiota adapted to the digestion of raw protein and natural fats. So the transition should take place in stages, starting with a simple mix of lean ground beef with cooked vegetables and purees rich in soluble fiber, such as pumpkin and carrots. This combination serves as a bridge between ultra-processed and living food. The goal is to stimulate the beneficial bacterial flora without overloading the puppy's still immature systems. During the first 5 to 7 days, it is important to monitor the stool. Texture, color, and frequency are valuable signals about the body's adaptation. No less important, the proportion of calcium and phosphorus in the diet must be controlled to the millimeter. Puppies have an accelerated demand for these minerals for bone formation and proper growth. The unbalanced supply, common in poorly formulated homemade recipes, can lead to deformities, irregular growth, or future joint problems. Here comes the critical role of raw, fleshy bones, such as ground chicken necks, for example, that need to be adapted to the size and strength of the puppy's jaw. Bones that are too large or hard are dangerous and should never be cooked. A mistake here can result in dental fractures or serious internal injuries. The introduction should start with ground or crushed bones mixed with the meat and then evolve into whole small pieces, always under supervision. Another aspect neglected by beginners is hydration. BARF, being a wet diet, naturally contributes to a good fluid intake, but puppies have more delicate requirements. The tutor must ensure that there is clean and fresh water available at all times, especially on hotter days or during phases of higher energy expenditure. The combination of raw meat and dehydration can cause constipation or electrolyte imbalance. In addition, it is important to remember that foods such as bones, even raw, have low humidity, which requires a balance with hydrated vegetables or homemade natural broths without salt. Supplementation is also a critical point. Many owners believe that offering beef or chicken liver occasionally already guarantees all the essential vitamins, but this is a myth. Puppies need precise amounts of zinc, magnesium, vitamin E, B complex, and omega-3, especially DHA, which is essential for cognitive and neurological development. A poorly balanced BARF diet at this stage can compromise not only growth, but the dog's ability to learn, socialize, and behavior throughout life. Therefore, either the tutor studies in depth with the support of veterinarians specialized in raw nutrition, or has menus formulated by professionals based on the weight, age, and breed of the puppy. Finally, there is the emotional factor. The food transition is also a psychological experience for the dog. Puppies accustomed to the dry and artificial texture of the food may be surprised by the new consistency, the strong smell, and the temperature of the raw food. It is not uncommon to see puppies that sniff, lick, but do not eat immediately. Therefore, the first contact should be in calm moments without pressure, with positive reinforcement. Never force feeding. The dog needs to trust the environment, the smell, and above all, the tutor. This forms a healthy and lasting food bond, which even helps prevent selectivity or future rejections. Starting BARF the right way isn't about fads or trends. It's about respecting the body's time, understanding the unique needs of puppies, and being an active part of building a strong immune system, a balanced mind, and a healthy body for life. The choice isn't just nutritional, it's a commitment to your dog's future. Although many owners focus only on what to put in the pot, the real success of the BARF diet for puppies is behind the scenes: storage, handling, hygiene, and routine. A single carelessness in the preparation chain can compromise the entire nutritional effort. Puppies are especially sensitive to contaminants, and even if the meat is of good origin, if thawed in the wrong way, poorly preserved, or handled on contaminated surfaces, the risk of bacterial contamination is real. Salmonella, E. coli, and Listeria are the most common, and in puppies, an infection of this type can mean hospitalization or even risk of life. Raw meat should be kept frozen at sub-zero temperatures and thawed slowly in the refrigerator, never at room temperature. After thawing, the ideal is that it should be used within 24 hours, and what is left should be discarded. The feeding bowl should be washed with hot, soapy water after each meal, and the owner should wash their hands thoroughly before and after handling the ingredients. Another crucial aspect is the frequency of food. Unlike adults, who can eat once or twice a day, puppies need fractionated meals. According to age, the ideal is to offer 3 to 4 daily servings, distributed on a regular basis. This prevents hypoglycemia, especially common in small and toy breeds, in addition to favoring digestibility. Puppies' stomachs are small, so large volumes of food at once can cause vomiting or diarrhea. Each meal should be balanced in itself, that is, contain all the necessary groups: muscle meat, appropriate raw, fleshy bones, offal in small proportions, vegetables, seeds, and supplementation when indicated. It is not about balancing the diet throughout the week, as seen in adults. In the case of puppies, the balance must be daily, meal by meal, as their body reserves are still minimal and the metabolism extremely active. The consistency of the diet also directly influences the dentition. Dogs that are fed natural and raw, chewable foods from puppies have better jaw development, more correct dental positioning, and less tartar accumulation. Chewing whole pieces, such as meat with long fibers or small pieces of cartilage, stimulates facial muscles, calms the puppy, and contributes to mental health. This is because the act of chewing activates areas of the brain associated with pleasure and emotional self-regulation. Even puppies that show destructive behaviors, such as chewing on furniture or slippers, are often just signaling the need for adequate chewing stimulation. The introduction of soft, raw bones, such as ground chicken wings or quail necks, can meet this need safely, always respecting the teething phase. During the transition to BARF, it is essential to also respect the individuality of the puppy. Brachycephalic breeds, such as bulldogs and pugs, have anatomical particularities that make it difficult to swallow certain cuts or sizes of bone. Large breeds, such as Labradors or Shepherds, have very accelerated bone growth, which requires more precise control of calcium and energy. Toy breed puppies, on the other hand, need extra attention to blood glucose and calorie density of the meal. Therefore, there is no universal menu that fits everyone. Personalization isn't a luxury, it's security. Another recurring mistake is to believe that BARF does not require veterinary monitoring. The truth is that, unlike feed, where the levels of each nutrient are already calculated and stabilized, the natural diet requires continuous monitoring. This includes weekly weighing of the puppy, assessment of the growth curve, stool consistency, energy levels, sleep quality, skin and coat appearance, and general behavior. Small changes may indicate excess or lack of some nutrient, inadequate digestion, or the need to adjust the proportion of fat, protein, or fiber. And because the puppy's body changes rapidly, what worked well 2 weeks ago may no longer be ideal today. A monthly follow-up with a veterinary nutritionist is the best investment that the tutor can make to ensure the effectiveness of the BARF diet. In addition, it is worth remembering that puppies in the vaccination or deworming phase may show fluctuations in appetite or changes in intestinal flora. At these times, raw food requires even more caution. It may be indicated to temporarily use broths rich in collagen, such as chicken feet or beef cartilage, or to reduce the complexity of the meal for a few days, increasing it again according to the body's response. Active listening to the tutor is one of the most valuable tools in this process. Observe without anxiety, without haste, and with sensitivity. Finally, it is worth reinforcing, BARF is not just a menu, it is a philosophy of care. It is choosing to see the dog as a dynamic organism, capable of responding with health, vitality, and longevity when fed in a biological and respectful way. And when this process begins in the first months of life, the positive impact is amplified. Stronger bones, shinier coat, more robust immunity, and above all, a deeper bond between owner and puppy. Because those who feed with their own hands form bonds with their eyes, with smell, and with time. One of the most neglected points in the introduction of BARF for puppies is the control of health parameters throughout the first few weeks. Proper nutrition goes far beyond the food itself. It translates into objective responses from the body, and each tutor needs to learn to identify the signs. A puppy that is well adapted to BARF has well-formed stools, reduced volume, and a less aggressive odor. The urinary frequency is regular, the coat has a natural shine, and the skin remains elastic without recurrent flaking or itching. The eyes are clean, without persistent secretions, and the mood is stable, neither too apathetic nor agitated for no reason. Any deviation from these signs can be a warning of nutritional or digestive imbalance, and the sooner this is noticed, the easier it will be to adjust the diet safely. Another valuable indicator is growth. Unlike dogs fed with kibble, where the growth pattern is usually accelerated and homogeneous, puppies on the BARF diet tend to grow in a more controlled and physiological way. This means that the owner should not compare his dog with others of the same breed who are being fed commercial feed. The focus should be on the proportionality of development, whether the puppy is gaining weight steadily, whether the limbs are firm, and whether the body posture remains balanced. Excess protein, for example, can cause too accelerated growth, which compromises joints and tendons in large breeds. Fat deficiency can lead to weight loss, decreased energy, and poor absorption of fat-soluble vitamins. Therefore, the evaluation should be weekly, not only for aesthetics, but to prevent structural problems in the future. Many owners also wonder, when can the puppy eat the same menu as an adult dog? The answer is, only after the growth plates have closed, which usually occurs between 10 and 18 months depending on the breed. Until then, the diet needs to be formulated with an exclusive focus on the needs of the puppy. This includes a different ratio of calcium, phosphorus, fat, and metabolizable energy. A formula that works well for an adult shepherd can be harmful to a 4-month-old husky. This is one of the main reasons why owners who try to adapt adult recipes for puppies without guidance end up seeing dogs develop bone problems, hair loss, allergies, or apathy. Within the BARF for puppies, there's also room to include functional foods that favor immunity and digestive balance. An example is turmeric, which, when used in minimal doses, can help with inflammatory control and joint health. Goat's milk kefir, introduced with caution, provides natural probiotics that help in regulating the intestinal flora. Wild fish oil, rich in DHA and EPA, is essential for neurological and visual development and is especially indicated in the first 12 weeks of life. But beware, all these ingredients should be introduced gradually, with pauses and observation of the effects. Puppies have little physiological reserve, and any excess can generate side effects, even if they are natural foods. Another important point is the temperature of the food. Puppies should not consume cold food directly from the refrigerator. Ideally, the meal should be removed in advance and reach room temperature, that is, slightly heated in a bain-marie without ever being cooked. Very cold foods reduce digestive efficiency, cause gastric discomfort, and can trigger food refusal, especially in the first days of transition. In colder regions, this care must be redoubled. A common mistake is for the tutor to interpret this refusal as a tantrum or freshness of the puppy, when in fact the thermal discomfort is preventing full acceptance of the diet. In addition, it is recommended to keep a food diary during the first 30 days of transition. In it, the tutor must record the ingredients offered in each meal, the reactions observed, such as feces, behavior, sleep, and appetite, and any atypical symptoms, such as vomiting, flatulence, or itching. This diary is a valuable tool for both self-assessment and consultations with professionals. Often, owners forget what was offered 2 days ago, or do not realize that the introduction of 3 new ingredients at the same time makes it difficult to identify the cause of a possible adverse reaction. The routine also impacts the acceptance of the diet. Puppies thrive with predictable schedules. Feeding at different times, or with many changes of ingredients without standard, can cause food insecurity. The dog, as a species, benefits from the ritual, knowing when to eat, what to eat, and what the environment will be like. Therefore, the ideal is that meals are always eaten in the same place, with the bowl on the floor, without distractions, toys, or noises that stimulate agitation. If the puppy is fed to other dogs nearby, the owner should watch for competition or anxiety. Shy dogs may eat faster than ideal, or even refuse food if they feel threatened. The more dominant ones, on the other hand, may try to bite the other's meal, which causes caloric imbalance and potential conflict of territory. BARF for puppies, when well conducted, offers not only physical benefits, but behavioral stability. A puppy that receives highly bioavailable food with active chewing and positive interaction with a tutor becomes more confident, attentive, and less reactive. He learns from an early age that eating is an act of care and not an automatic obligation. This emotional learning shapes the dog's behavior in adulthood and significantly reduces the risk of problems such as food possessiveness, compulsivity, anxiety, and extreme selectivity. The complete transition to natural food requires fine adjustments as the puppy develops. The first year of life is marked by rapid physical and immunological transformations, and therefore, the tutor must understand that the ideal quantities, proportions, and ingredients at 2 months will be different from those needed at 4, 6, or 12 months. The best thing to do is to divide growth into 3 phases, weaning at 3 months, 3 to 6 months, and from 6 months to the first year. In each of them, the fat content, the proportion of fleshy bones, and the introduction of vegetables and supplements vary slightly, respecting the metabolic stage and the needs of the growing organism. In the first few weeks, the diet should be richer in fat and collagen, with less plant fiber and almost no liver. As the teeth firm up and the digestive system adapts, it is possible to include giblets, small amounts of liver, and gradually increase the diversity of meats and organs. Fleshy bones, such as chicken necks or rabbit ribs, are offered more regularly from the 4th month onwards, always with supervision, adequate texture, and in cuts appropriate to the size of the puppy. Puppies do not have enough energy reserves to tolerate long fasts. Therefore, in the early stages, the ideal is to divide meals into 3 to 4 portions a day, with well-defined times, a quiet environment, and time to eat calmly. The pace of growth is another key indicator. If the puppy gains weight quickly with no apparent fat accumulation and maintains disposition, shiny fur, and consistent stools, it is a good sign. On the other hand, if there is excessive weight gain, or if the puppy shows apathy, itching, or persistent diarrhea, it is time to review the formula, adjust the proportions, and, if necessary, consult a veterinarian with experience in natural nutrition. One of the most common mistakes made by beginners is ignoring the signals from the animal's body. The puppy's body responds clearly when something is out of balance, and this can be seen by the change in feces, breath, behavior, skin reactions, and urinary frequency. It is not a matter of letting the body get used to it with something that is doing harm, but of respecting the adaptation time and intervening whenever necessary, with responsibility and sensitivity. Another recurring question is about the need for supplements. Although the basis of the BARF diet is composed of whole and fresh foods, in some specific cases, supplementation of fish oil, vitamin E, zinc, probiotics, or even calcium may be indicated, especially if there is limited access to certain ingredients in the region where the tutor lives. However, all supplementation must be judicious and temporary. Excess fat-soluble vitamins, for example, can generate poisoning in the medium term. The golden rule is to seek variety within one's own diet, rotating proteins, chicken, beef, lamb, pork, rabbit, fish, and alternating offal, vegetables, and fruits. Food diversity simulates what an animal in the wild would have access to, and reduces the chance of deficiencies or excesses. In the long run, a puppy fed a balanced BARF diet tends to develop stronger bones, a more robust immune system, greater disposition, better digestion, and a lower propensity for chronic disease. All this with a deeper connection with the tutor who learns to observe, care for, and respect their dog's natural rhythm. Finally, it is important to remember that BARF is not a magic formula, nor a fixed recipe that fits everyone. It is a food philosophy that requires study, adaptation, and constant monitoring. By offering your puppy a natural diet, you're taking an active role in his health. It's saying, with every serving prepared, that he deserves the best from the beginning of life. And this decision isn't just about nurturing, it's about bonding, awareness, and responsibility. For those who choose to follow this path, each meal is an investment in the animal's future, a healthier, happier, and more connected future.